Hi, I'm Dr. Anis. I'm a physician with a background in clinical education, CDI, and compliance training, and I'm the co-founder of ChartMate. ChartMate is an AI-powered clinical assistant designed for providers who work in the SNF long-term care setting. Now, from my experience, I've seen firsthand the toll that documentation takes on providers working in these settings. And my co-founder, Dr. Rekha Bandari, has been in the post-acute and SNF industry for close to 2 decades now. And we kept seeing the same cycle. Hours of pajama time spent on notes, the dangerous habit of copy pasting, and a complete lack of patient context in these notes. Now, this leads to massive burnout, but also real financial risks like rejected claims, non compliant documentation. So, we decided to build a tool that would bridge these gaps. So we conceptualized ChartMate, and what ChartMate does is basically understands these complexities of the post-acute setting. It automates the heavy lifting of documentation, and what it maintains is the clinical integrity in each and every piece of documentation. From the very first interaction, I was pretty impressed with their technical capability, which was very obvious from day one. As soon as I started discussing about what I want and I told them my concept, I was impressed. They stood out for their responsiveness. And in software development, you need a partner who gets the vision quickly. And that's what Abstrabit did. They just resonated with my thoughts, with the whole idea. And anytime I wanted a particular feature, or I wanted things to be implemented in a way, even if it was last minute, they were very responsive. So the team at Abstrabit actually didn't just build what we asked for. They always understood the why behind each and every feature or each and every idea that we were trying to bring into this tool. And that's what made them the clear choice in throughout the process. And their timeliness, very strict on the timelines. I have worked with other service providers in the past, but Abstrabit was thoroughly professional, and they were always, responsive. Any time of the day you respond, they had solutions, they had answers. I'm really impressed, to be honest. The highlight of ChartMate is its ability to turn simple provider inputs into structured, compliant, and context-aware progress notes across any settings. So our first product completely focusing towards SNF setting, the long-term care setting. We address all the range of facilities from SNFs to assisted livings to hospice. So for health professionals working in these settings, the impact is twofold. We are giving them their time back by eliminating hours of manual typing and documentation. Secondly, we are providing a peace of mind. How? We ensure that the notes are compliant, grounded in patients' actual clinical data, and we are reducing the risk of audit denials. Now, that is where we stand out. That is what we promise, which a lot of other tools currently available cannot. By ensuring that we help the providers focus on what they actually went to school for. That is basically caring for patients, spending more time by the bedside, taking care of the patients better. We have already beta tested with a couple of providers, and the response is fantastic. Seeing a clinician's face light up when they realize how much time they have just saved, and getting to know how, I see that happiness in their eyes, how much time they're able to spend with their family members or doing something what they love, rather than just sitting in front of the computer and charting all day and stretching it towards late nights and the weekends. I must tell you, this Abstrabit has helped make that possible. We are currently in the final phase of preparation and are incredibly excited to begin our full rollout in just a week. Looking ahead, our focus is on deepening our integrations, getting more integrations in terms of EHRs. We want to add more and more EHRs that we are compatible with, we are able to push and pull information. Then we want to continue refining our AI to handle even more complex clinical scenarios. We want ChartMate to be the standard for documentation across entire post-acute continuum and also other settings. Now, I must say that Abstrabit has played a very key role in helping us integrate with point-click care in a seamless manner, and I would say in a record time. Integrating with the leader like point-click care was absolutely vital, and in the skilled nursing facility and LTC world, the EHR is the heart of the facility. Now, we are able to surface ChartMate's documentation directly with the PCC environment, and we are ensuring that the care team has immediate visibility into the latest provider notes. So this integration expands our scope from just a tool to being a seamless part of the clinical workflow and supporting better continuity of care and making ChartMate an essential partner for any facility using PCC. The usual integration timeline is around 4 to 6 months, and we were able to achieve it probably around 3 months. They were able to resonate with all those ideas. They were able to implement whatever we had asked for. And these kind of integrations with EHRs or any other third-party integrations, that if you are looking into any API integrations with EHRs or any other softwares, I would recommend Abstrabit any day.